Hi, I'm Dr. Jenna Scare, better known as DocJenFit, and we're gonna go over my top 5 stretches when you're feeling that acute knee pain. So whether it's from jumping, from running, from some random thing that you don't know why your knee is hurting, I'm gonna give you 5 easy stretches that you can start to do today to really ease that tension on the knee and help to provide some relief. So the first one we're gonna do lying on your stomach, and this is called a prone quad stretch. You could do this on a couch, on your bed. It's really accessible and easy, much easier than putting any pressure on your knee, so that's why I really like this stretch. So all you're gonna do is you're gonna reach back for that foot. If this is too difficult, you can always wrap a towel, a belt, a strap, anything around your foot, and then kind of bring that towel or strap or even like a long blanket, you can kind of make a knot around your foot and then bring it over your shoulder. Sometimes I like to bring it over the opposite shoulder so that it's not pulling out to the side over here, okay? Otherwise, if you can, reach back for that foot. Now, what a lot of people think is a quad stretch is just pulling it to your heel. Yes and no. The quad crosses 2 joints in the body. So not only does it affect the knee, but it also affects the hip. So if we want to maximize what we're doing in that quad, I want you to not just pull from the hip first, or not from the heel first. I want you to actually tuck that tailbone under. So before you even pull, start to tuck that tailbone under, and almost like you're going to squeeze your butt and pull that hip bone up towards your rib cage. So we're gonna pull up right here and then hold. If you feel any tension around that knee, that's where you stop. If it's painful, back off just a little bit from that hip. But you'll realize that by changing the angle of the pelvis, it changes the stretch and the dynamic on that quadricep muscle, so you don't need to just pull from here, because this might not do anything for you. Okay, so first start with that tailbone, and then if you need more, then you can pull in a little bit deeper. Okay, the goal, really relax, breathe, and hold this for about 2 minutes if you can. So just really slow breaths, relaxing. We're trying to ease that tension right on the front of the knee through the quadricep muscle, okay? The next one that I really like doing is making sure that you're open in that knee joint itself, because a lot of people who have knee pain cannot quite sit on their bum here, okay? So we're gonna take a towel and we're gonna roll it up, and we're gonna do what is called distraction right at that knee joint. So kind of opening up the space between these 2 bones here, okay? So we're gonna take that right up into that knee, and then we're going to attempt to sit all the way down, okay? Maybe you need some pillows stacked underneath you at the beginning. That's totally fine. Maybe you need to support yourself. Whatever you need to do to slowly start to ease into that knee flexion. Now, this might take a while to actually get into full knee flexion, so take your time, but taking your time means that you actually get to do it over and over and over again to really see the progress, okay? This isn't just like you're gonna get it overnight. It might take a little bit of time to ease that tension, open up that pressure, and allow you to sit fully onto that heel, okay? That's the first one. You can even keep this in here if you need it for the next one. So we're gonna stretch and open up that ankle. Whenever we have knee issues, yes, it's okay to address the quad. It's okay to kind of massage around the area, open up the knee joint, but we always want to assess what's happening above and below. And that's what we're going to do on these next 3 exercises, okay? We're going to open up the ankle and open up the hip. It is so important that we look above and below the area, because it is connected to the pressures that are placed on the area, especially if we're talking about acute kind of knee pain at the kneecap, on the inside or outside of the kneecap, underneath the kneecap, any of this front of the knee pain, super common, and there are ways to work on it, okay? So scoot that foot back a bit, and then place some pressure on that foot. This is a lot easier to do if you elevate the surface as well. So putting your foot on a bench or a chair really helps to be able to get into this stretch just a bit more. The goal is to keep that heel down and really allow that knee to pass over the toe and hold it for about 2 minutes at a time. Okay, now what's really important here is again, figuring out what's happening at the knee. Is it the ankle that's super tight? Maybe you need to spend a lot more time here on a daily basis, or maybe the hip. Or maybe there's movements that you're doing. So we talk about this a lot more on the Optimal Body podcast. We actually have a podcast on the front of the knee pain, so like jumper's knee or patellofemoral. If you don't know what this is, go listen to the episode because we talk all about the front of the knee pain. If you have more meniscal type pain, that you know you've had some meniscus injury, we also have a podcast on that. And we also have had a podcast on, I think there's another type of knee pain, maybe not, but anyways, we've had a lot of different pains on the podcast, so go listen to the Optimal Body podcast. I promise something has been answered on there. Okay, after we're done with about 2 minutes of that, we're gonna go into the hip. So now for this hip stretch, we are actually gonna go into more of the external rotation. So we're gonna focus on the front. So we want to be in like 90 degrees here. So from the shin to the upper bone here to the thigh, you want about 90 degrees and 90 degrees between the legs, okay? It's not so important, but we're just gonna start to stretch open. So as we do this, you wanna think the pelvis is kind of tilting forward and that hip bone in the front is rocking into the thigh, and then we're gonna reach forward with a flat back and then come out of it. So you can hold it here if you would like. You can rest here. You can do some activation where you're just kind of without even touching it, you're just leaning forward and coming out of it. There's so much that you can do, but I promise if you get on the floor every day and you spend some time in this position, it is going to improve and it can help to relieve some pressure. And the reason I do the 90-90 here instead of the pigeon is because we don't want to put a lot of tension on the knee that's already a little bit irritated. So we definitely want to get into this more open position, and then you can do some reaching and stretches. Remember, it's not about rounding in the back, but keeping a really tall spine and then reaching forward to get into that hip, okay? The last one that we're gonna do is addressing the inner thighs. So we address the outer thighs, and the front of the thighs. Let's do the inner thighs, okay? So this one is Adductor Rocks. You're gonna be on all fours, place the leg out to the side, and again, tip that hip bone forward. So hip bone into your thigh here. Keep that position, so don't let it round back. So keep that open position, rocking it back and forward. And you could feel that adductor stretch, that inner thigh stretch all the way into the inside of the knee. So it feels really good here. Just rock back and forth a few times. Maybe you hold and breathe, okay? So many variations to every exercise. As long as you're getting into these positions that feel really tight and restricted, you're using the breath to kind of open it up, I promise you're gonna start to feel something different around the knee. So especially if you're having acute episodes of knee pain, let me know below. Let me know if you tried out these exercises, if you're feeling something different, and then pass it along to someone else who you know can benefit from it as well. Don't forget to subscribe so you don't miss out on any future YouTube videos and education that you can really learn and support your own body.